Hello, my name is Dr. Steve Kregel. I work here at St. Cloud Ear, Nose, and Throat Clinic, and I'm here to tell you just a little bit about cochlear implants, who needs them, what it's like to have them placed, and what to expect after you have placement of a cochlear implant. So, first off, who needs them? This would be a patient who has severe to profound hearing loss, basically someone who has tried hearing aids and has used them for many years perhaps even, and has found that they're no longer able to hear conversations, they're no longer able to hear people on the telephone, they have maximized their use of traditional hearing improvement instruments, hearing aids, and are unable to benefit from them. So these are folk with very severe hearing loss. Occasionally we find this in babies and very small children. Quite often this happens progressively over time. So someone who had hearing loss and was doing well with hearing aids, as the years go by, they end up having such severe and profound hearing loss that they're not able to get benefit from normal hearing aids. So, folk with very severe hearing loss are indicated for this procedure. What is this procedure? It is an implanted device that is placed with a receiver in the back of the ear, and then a wire that actually goes behind the ear and underneath the eardrum and into the inner ear called the cochlea, and the wire directly delivers electrical energy that contains sound information directly to the hearing nerve, bypassing the eardrum, the ear bones, and the cochlear fluids. So this is a way to directly stimulate the hearing nerve when the intervening tissues, especially the tissues in the cochlea, are no longer able to do that. And it can restore a tremendous amount of volume to the hearing. It's a completely different way to hear, and so it takes some getting used to. So when the surgery is done, there's a waiting period afterwards to let the tissues heal, and then the first step in programming is taken. But let's step back to the procedure itself. This is a surgical procedure. We make an incision behind the ear. The bone behind the ear is removed partially so that we make a tunnel into the inner ear. This goes underneath the eardrum, and this is the way that we pass the wire into the inner ear cochlea area. The rest of the device itself is actually implanted underneath the skin, just on top of the skull bone behind the ear. There's a magnet to which we then attach the external device, the hearing aid portion, if you will, attaches by a little magnet to that area, and then the electronics is in a box that hooks behind the ear, very much like a traditional hearing aid. So once that's implanted, then the incision is sewn up. A very tight dressing, bunch of gauze with a band of gauze around it to put pressure onto the area, is utilized for the first 2 days to reduce swelling to the area. The sooner the swelling after the surgery goes away, the sooner we can place the external device and begin the programming process. So after 2 days from the surgery, and by the way, the surgery does not require an overnight stay. Typically, even elderly patients who have the procedure can go home the same day. 2 days later, you come back to the clinic. We remove the external dressing. We check the incision to make sure it's healing well, and it usually heals beautifully. And then we set an appointment for 3 weeks. 3 weeks is to allow any further swelling to go down, for the incision to heal, for everything to be ready for the first step in programming. At that next appointment, I check you again, or your doctor checks you again to make sure the incision has healed well, make sure there's no swelling or puffiness over the magnet site. And then the audiologist that you're working with will begin the process of placing the magnet device on the external skin, and that's held on by the device that's underneath the skin. And then it's got a wire to the little hook that hooks behind your ear. There's no portion that goes in your ear because we're not using the eardrum for hearing anymore. So the pickup is actually on the little box, and it transfers the electrical information through that magnet into the internal electronic information beneath the skin, which then sends the electronic information directly to the hearing nerve, thus restoring hearing. Now the hearing you have will be different. It will not sound the same. So initially some people described that a dog barking might sound like a mouse squeaking initially, or water running might sound like some squeal or odd sound. So that there's a sense in which your brain has to get used to over time, get used to this new way of hearing. But it's very successful, and trust the many patients who've had this done in the past to say that you will hear much better. Some people are even able to use the telephone again for their for hearing, and definitely in-person conversations are much better able to be picked up through the cochlear implant. So this is a process that lasts for several weeks or several months during the programming phase, but during that time you're beginning to hear better and better. So in short, it is a surgical procedure that lasts about 2 hours or so. The recovery time is a couple of days typically, and then after 3 weeks from the time of surgery, we can begin the programming process, which then takes weeks to months to complete. And this is how we restore your hearing with a cochlear implant.